And good afternoon, everyone. Happy Good Friday. And thanks once again for joining us in this our continued dialogue on COVID-19 and its impact here in Orange County and surrounding areas. Bringing us information and remarks in this press event today are Orange County Mayor Jerry Demings, Orlando Mayor Buddy Dyer, and Dr. Raul Pino, Health Officer for the Florida Department of Health. For our reporters in the room, as we have dual microphones today to increase our social distancing amongst our officials. You don't have to ask all your questions at one time. You can ask them of different individuals, and they will go to the microphone. We just asked reporters, please ask all of your questions at one time so that we can minimize our mic runner in terms of his activity and so we can have social distancing as well. So starting us off with information today is our Mayor, Jerry Demings. Mayor.
All right, good afternoon. As we all observe Good Friday, this is probably a Good Friday like none of us will ever see again, and we hope that that is the case, that a year from now we're not dealing with another pandemic. For me, for my family, this Easter season is always very special to our family because it normally is indicative of us getting together as a family at my parents' home, and we will not be able to do that this year, just like many of the other families, because we'll be practicing social distancing. So it's not lost on me that it is impacting us in significant ways. I encourage you to continue to remain in your homes, and when it is absolutely necessary, and only then should you be going out into the public. And we're asking our public to continue to comply with the directives that we have put in place, and we encourage you to wear masks and stay at least 6 feet away from each other. These are tough times, and I know that the messages that we are providing are somehow sinking in within our community, because I see it when I go out into the public. I see people who are staying away from one another. Remember that we are not out of the woods yet when we are fast approaching nearly 900 cases now. In fact, when we look at the state's website, today we have 895 cases here in Orange County. Remember when we started the week out, we suggested to you that we may see 1,000 cases before the end of the week. And perhaps we won't reach that number, but we're getting very close to that number when we look at it. We now have 13 people who have died in this community of the COVID-19 virus. And in just a few moments, Dr. Pino will talk more with you about those specifics. And the last time we came together, I highlighted an individual, 81-year-old male that had died, who I knew. And I give credit to Steve Hudak from the Orlando Sentinel. He has followed up with that story and has now written about that particular family. That reminds all of us that these are real circumstances that we are dealing with. When we look at the heat map that you see over here, Orange County has 53 zip codes. 49 of those zip codes have at least one case within that zip code. So it has impacted us throughout the county. We are entering a time where if we continue to work together, however, we may finally see the number of new COVID-19 cases flatten. That is our goal with all of this. This week I had the opportunity just a couple of days ago to meet collectively with, at least via WebEx, with the hospital CEOs here. And that was the CEO from Orlando Health, Advent Health, and HCA. And they shared with me some information regarding their respective predictive models. Those models were trying to take a look at the current capacities within our hospitals and project, as new cases would come in, at what point would we either meet or exceed capacity of that hospital system here. And I'm happy to report to you that if the models hold true that the hospitals presented to me, they have the capacity to meet the needs within our community. However, we always have to plan for the worst case scenario, and if we exceed that capacity, we wanted to have a contingency plan. I'm also happy to report that I reached out to the governor. We had a conversation this week, and I had a conversation with the director for the Florida Department of Emergency Management. And what they reassured us was that should we exceed our local capacity, that they will respond from the state level with a field hospital that would be set up as an alternative medical site at the Orange County Convention Center. That would be a regional asset. So I have to give some kudos to our surrounding counties, that being Osceola, Lake, and Seminole counties working with us. We each drafted letters to the governor volunteering the site at the Orange County Convention Center to act as that field hospital if the need should arise. We hope that that doesn't happen. Again, I reiterate that given the different predictive models that the hospitals provided, we have the capacity to meet the needs in our community. Now, when they talked about when will we peak, that differed with each one of the hospitals. That peak period of time could occur next week in one of the models between April the 12th and 19th. Another model said the peak would happen on April the 21st. And then at the latest, one model indicated that the peak would happen either May the 5th or the 6th. But for us, we are going to be prepared either way. Now, when we look at the data that is happening here within our community, we do see the number of patients who are requiring hospitalization to be declining. That is what the hospital said to me. Even though we have new cases occurring, the majority of those cases represent individuals who have minimal symptoms, and they're able to deal with the virus by staying at home through other modes of treatment. They're not being required to be hospitalized or to be put on ventilators. So that's a good sign for us, I believe, going forward as a community. Let me just share some other information with you. Starting Monday, the state will begin to test anyone who has had repeated encounters with infected people with COVID-19. The idea is to see how the virus will spread from residents who have no symptoms. We will have more information on our website about the testing that will be done by the state. I want to take a moment to recognize our healthcare providers. Last night, many Orange County buildings turned blue in solidarity with the community around the world, the communities around the world. The idea was to light up the buildings to show global support and gratitude for healthcare professionals and essential workers. Thank you to all of those fighting on the front lines against COVID-19. Let me shift gears a bit and talk about business at the county. Our business activities are continuing to be strong. Despite the pandemic, construction activity in Orange County is continuing at a steady pace. As you know, our permits are now being issued primarily online because of the efficiency of the online review. Turnaround times for reviewing project plans are actually faster than they have ever been, and they're exceeding our goals. Seeing development activity continue during this crisis is encouraging. This provides a look into the future about how fast we may rebound from the slowdown in our economy. Our permitting, inspections, customer service sections within the division and building safety area are very busy, with over 1,100 permits issued and nearly 5,000 inspections just in the last week. So I know many people in our community, especially the business community, they are concerned about how fast we will recover from this. If you take a look at the number of permits that we're processing, the business activity, the construction, that gives us a glimpse into the future, which I think is encouraging to us. In comparison to the previous weeks, the numbers I just shared with you are within the average range. So while we are being negatively impacted in some ways by this virus in our community, we have been able to maintain at least one sector of our business community. Modified service information, training tools, and partner information are all available on the Development Services tab of the Orange County COVID-19 webpage at ocfl.net/coronavirus. And finally, I want to give a shout out to our boys and girls who took part in our virtual Easter egg contest. Since we're in this phase of social distancing, those Easter egg hunts that we would normally do have not taken place and will not take place. Since Orange County's annual Easter egg extravaganza was canceled, we put a virtual Easter egg on our social media sites for the children in our community to decorate. We had a strong response. Even an 85-year-old child sent in a design. But we aren't done. I want to invite all of you to join us Sunday morning as I will be reading a book called Pete the Cat Big Easter's Adventure. It will be posted on our Facebook page Easter morning. So we challenge you to join us on Easter morning through that virtual activity. At this time, I'm going to ask Mayor Dyer to come forward. He's already there to offer words to you as well. Mayor Dyer.
Thank you, Mayor Demings. And to follow up on your comments related to our hospital systems, I had three real takeaways. First was that their models are significantly different this week than they were last week. The second, if these models are correct, they have the capacity to handle the surge and whatever peak we have. But thirdly, and probably the most important thing, is they attribute it to the mitigation efforts that we've taken, like staying home. They absolutely said the reason these models have changed and the reason that we can sustain this and be able to handle the surge is because our residents have stayed home, they've practiced social distancing, and we believe we can continue to flatten that curve and mitigate the surge to our hospitals even more, but only if we continue our efforts. We are at a critical moment right now. We can't be complacent, so we must remain diligent and disciplined and continue to stay at home and social distance. These continue to be challenging times for our business community, and I'm proud of a number of our local businesses and the way they have continued to help our workers. Orlando Universal Resort has been paying its workers 100% of their salaries since they closed on March the 16th, and they're going to continue to do that through mid-April. They've helped their team members and their families and therefore tens of thousands of people across our community weather this storm. And we heard yesterday that, like other businesses, they've had to make some tough decisions. So they announced that they'll remain closed through at least May the 31st, but they're still going to pay the majority of their workforce 80% of their income, continuing to help thousands of people. And while the current situation is requiring them to make the hard decision to furlough part-time hourly team members, they're still going to pay them 80% through May the 3rd, and after that, they'll continue to pick up the cost of their benefits. So I want to thank Universal for your continued investment in our employees and our community. OUC, our city utility, continues to provide critical services, and yesterday announced that they would be contributing $12 million to further our community through this COVID-19 crisis. The funding will offer immediate relief by lowering utility bills and providing assistance to both residential and business customers over the next year. The city is a partner in this effort. We're diverting a portion of our annual dividend payment that we receive from OUC back to OUC to help fund this effort and help more of our residents get through. So I want to thank OUC for their continued partnership in their efforts to help our residents. Additionally, we have partnered with Advent Health and the Orlando Magic to transform the Amway Center into a hub for healthcare equipment and supplies that Advent Health will use throughout their system and distribute those supplies to the 50 hospitals that they have in our region and in 7 other states across the country. So we're proud to have partners like Advent Health and the Orlando Magic who are helping now and preparing for the future. And as a city, we're very happy to help in that effort. I also want to thank all of our healthcare professionals and those on our front lines that are working tirelessly to help our Central Florida community be safe every single day, and the organizations and local community groups that inspire me every day. Parishioners at St. Philip Phan Van Minh Vietnamese Catholic Church in College Park called and wanted to figure out a way to help local law enforcement. And this week, their parishioners, some who are owners of nail supply stores, which are currently closed, donated nearly 50 boxes containing 1,000 gloves each to our first responders at the Orlando Police Department. SC Johnson Wax, through the CDC Foundation, is donating 1,500 individual first responder cleaning kits to the Orlando Police Department and Fire Department. Each individual kit includes disinfectant cleaners, sanitizing sprays, and hand soap. So I want to thank those organizations to fight this virus. We end another week in this fight, and its impacts on our community are not over. We must continue to be responsible, not just for ourselves, but we're doing this for others, the vulnerable, the essential workers who are on the front lines who can't stay home. Every day I continue to be inspired by our residents because you are taking this seriously, just like we've asked you to do. You're staying at home and your efforts are making a difference. We are flattening the curve because of our individual actions and behavior, but we still have more to do. We continue to be vigilant. Thank you for what you've done, Orlando, and what you continue to do. We must keep at it, keep staying disciplined, keep staying smart, keep staying safe by staying at home. And I wish everybody a happy Easter. Dr. Pino.
Thank you, Mayor. Good afternoon. As the Mayor mentioned before, we have 895 positive cases in our county this far. And total tested in the county has been close to 10,000 people as of Wednesday. We have the age range continue to be from 0 to 101 years old, and we have 13 deaths, as it was mentioned before. The individuals that unfortunately has passed away, the last 3 addition to these sad list that we have is the first one is a 60-year-old female, Hispanic, that the exposure is under investigation and has pre-existing conditions. An 85-year-old Afro-American female with underlying conditions, and we have not been able to establish the exposure yet. And a 45-year-old Afro-American female with pre-existing conditions that we think acquire the disease on a travel to Michigan. And this highlights also the importance of continuing to adhere to stay-home policies that are in place, as well as new guidance that is coming through the CDC and our authorities. I would like also to say that there are some good signs in our data, but this is not a time to be complacent about it. It's actually the time to intensify what we are doing to prevent the spread of the virus, so that we can finally kick this out of our county, our lives, at least for the near future. The emergency rooms have reported some stable conditions, and I would like to thank our residents for adhering to our ask to stay away from the ERs. And I want to repeat that again. Please stay away from the ERs and only go there if you absolutely need it. There are other places where care can be given to you, community health centers, primary care, and some services as the Department of Health. Please do not use the ER for primary care. The mayors also spoke about the fact that our health system seems to be healthy. The data shows that we have a healthy balance of unused ventilators. We have a good balance of empty beds in the hospitals. Some hospitals are even as low as 50% operation. And that indicates that even in the case that we see an increase in the coming days, the systems are ready to take on that task. And the mayors have made provisions with the state in case that we exceed that capacity. Again, I would like to join the mayors in thanking our healthcare workers, but I also want to thank the people of Orange County for taking responsibility, for being proactive, and for keeping yourself away from the ER and support our healthcare workers. Thank you.
Okay, with that, we will open it up for any questions that you may have, and we will have the mics brought to you, and we remind you that if you ask a question in another language, for the sake of the viewing audience, if you ask it in English, and then if you want to ask it in Spanish, I'm sure Dr. Pino will respond in both. That way everyone clearly understands what is being said.
All right, Lauren Seabrook, Channel 9. I know I asked you about requiring face masks on Wednesday, I believe. The leaders in Osceola County have just decided to require that in their county. I know we see a lot of stuff that you guys do regionally. Is that something you're still considering possibly?
We are considering it. We have taken a look at the Florida statutes, and we have taken a look at the order in Osceola County and one that was issued in Miami-Dade County. And we'll try to make certain that we do something that is best for our community in the process to balance out, the unintended consequences sometimes of working unilaterally. We want to make certain that it is an appropriate response for our community. And so probably within the next day or so, we'll come to a conclusion on that.
Okay. And I was also wondering if you heard the governor's comments yesterday on considering reopening schools and what your thoughts are on if that were to happen.
In order to open the schools, that has to be one based on data, and I would assume that if the governor would do that, he would do it with the assumption that children aren't as susceptible to being exposed and testing positive to the COVID-19 virus. I looked at data today that Dr. Pino provided, and he can certainly respond to this as a physician. But there are individuals who are under 18 years old in our county who have tested positive. So it would be concerning to me if we open those schools too quickly. Certainly the adults who work within that system could be potential carriers, et cetera. So it would be concerning to me that we don't want to open too quickly. We want to have the right balance in that regard. And so that's a conversation that our public school system, that body, the school board, will have great deliberations about that in consultation with the healthcare experts.
Hi there, Eric Sandoval with News 6 and ClickOrlando.com. We understand the Florida Department of Health may be rolling out some testing, mobile testing units to some of the hard-hit zip codes in Orange County. Have you heard about that, and can you comment on that?
Yes, we are planning on that. So if we get the adequate resources, and I mean by resources, collection kits, because have to be something that we have to sustain. We have planned to, with the help of the county that is putting, food in the bill, they are going to rent a mobile clinic that we will take to zip codes, the harder hit zip code, and probably have an appointment system where we will test those areas. The idea is to reach out to individuals that normally do not engage with the healthcare, that don't have transportation, and also to get a better picture of those areas that are hit in the county. So we are in the planning phase. I think that in maybe a matter of a week, we'll have to be able to offer you more details.
Do you know how many people you'd be able to test or collect at any of those?
Yeah,
ones?
we calculated that if we have 3 bays, it would be on vehicles. We can do about 250 to 300 a day without exhausting the workforce. But again, that depends also on the volume of collection kits that we get.
Just one more question. The county is footing the bill for that. Do you know how much money you're putting towards that, Mayor?
Many of the state assets will be made available, and we're working very closely with the county health department, which is really a state entity.
Steve Hudak from the Orlando Sentinel. I want to follow up on those questions. We received, there was a posting actually on Facebook from a pastor in Azalea Park who's concerned about the disproportionate impact on minority communities, which already have some pre-existing disparities for travel. And what more can we do to reach out to those groups, also to have the testing, which you've already sort of addressed? I guess that seems to be a major concern. So what more can we do?
So I want to be clear here. Are you referring to perhaps a disparate impact in terms of the exposure to the virus itself?
No. Well, that's a good question. It has to do with they believe it's more difficult for them to be tested, to get to places to be tested, and actually in some cases just to understand what's being said, because sometimes we speak only in English, and some of those groups are only Spanish speaking.
Okay. So we have endeavored to, after any of one of these press events, we redact what is being said here and we post it in Spanish. We have a number of communications that go out that way. And then, of course, you have seen here where if there are questions asked in Spanish, if that's the language in question, you get a response in question. Now, in terms of disparate impact into communities, being able to get access to health care, any of those types of things, I'll let Dr. Pino talk to you a little bit about what he knows about the demographics associated with the people who have tested here in this community, and those who have tested positive, those who've been treated, et cetera.
So you are absolutely right. There are some interesting, from a data point of view, issues with any distribution of the disease. And but also what is interesting is health outcomes and who perform better and who get better outcomes than others. And that's where the question is. I think that I would like to remind people that there are existing health disparities that have been in our society for the longest. And they have nothing to do with COVID. It has to do with everything else that we have not done before to bring everyone to have access to health care and to have health insurance. And many people have health insurance associated with employment. So there are some big factors at the national level that may contribute to this. And what happens is when you don't have adequate health care, then you get into chronic conditions. And when you go into untreated chronic conditions, let's say Afro-American population is one that we have seen a lot of talk about COVID-19. So let's say high blood pressure is a high prevalence among Afro-American, especially undiagnosed high blood pressure, because of the lack of access to healthcare. And because the history, diet, access to healthy food, exercise, everything that we know about social determinants of health. So if on top of that you have that disparity present, and then comes a disease like this that preys on people who are older with chronic existing condition, it's a Molotov, it's a cocktail for disaster for minorities with chronic conditions that have not been treated for years. So that's where the issue lies.
Thank you. Okay, I just want to make sure, Steve, that we answer the question that you were asking.
I think so.
Okay.
Danielle Lama with Fox 35. An article recently came out in 24/7 Wall Street, and they looked at communities that they believe could be hit hardest by recession. Orange County was listed in the top 25, and that a lot of that is based on how closely we are tied to the tourism community and leisure and hospitality. How do you see that industry bouncing back in Orange County? And are you planning anything now to try and, recover faster?
Okay, I think the fact that our economy is one that certainly tourism is a significant part of the GDP associated with that economy is both a double-edged sword for us, because those theme parks provide jobs to collectively hundreds of thousands of people here in this community. Disney alone, 77,000 workers there. And the workers who work for our theme parks, many of them are service workers, but some of them also are engineers and make very good salaries because of what they do to design the architecture and the engineering behind those theme parks. In fact, sometimes we see those theme parks, what they develop there gets extrapolated into other industries, into modeling and simulation industries here that help to prepare our war fighters in the military services. And so that's a high-end business in terms of revenue potential there. So it is important, however, that we work collectively to get all of those businesses, inclusive of the theme parks, back operational as soon as we can. You've heard me say this before, and you've heard Mayor Dyer allude to this earlier today, that the fact that the theme parks made a decision to shut down was the right decision at the right time to help slow the virus and the spread here within our community, across the state and across the nation, and perhaps even across the globe. So we do applaud them. They have decided that while their employees will be furloughed for a definitive period of time, they will continue to pay some of their employees. They will continue to provide insurance to those employees, even if those employees for the next 60 days may have to draw unemployment. The sooner we kind of understand where we have peaked with this virus, the sooner we can understand how we can begin to relax some of the restrictions that have been put in place so that they can begin to operate again with certain, I think, sanitary protocols being put in place. In my humble opinion, this pandemic is going to cause many of those traditional businesses to rethink how they gain, how individuals gain access to those businesses. So I believe that you're going to likely see some type of screening that is done at some of these parks. You will perhaps see mandates for how their workers must dress, the wearing of protective mask or equipment. So our goal is to minimize the long-term impact on this community. But because there are jobs there, as soon as they open, and with the pent-up demand from across America, where Americans have been now in isolation for extended periods of time, we believe that there will be some pent-up demand. And when we open back up, hopefully the engines will be reignited and our economy will be turning at a very robust speed. So that's what I would say to those who look at the service demand here. The other thing that I would say is that we've been working now for decades to diversify our economy, and we've done a pretty good job. Now, the goal is to continue doing that, from higher education to financial services to health services and health care management. We have a new med school here, and all of those things that is happening here. We're the center of, I think, the universe in terms of modeling and simulation and the high-tech jobs that we're bringing in. We have been one of the leading metropolitan areas in terms of growth for high-tech jobs. All of that, I think, will continue. And I believe that as a result of this pandemic, there will be new entrepreneurial opportunities. There are businesses here who have adjusted their business model to be able to work within this environment. I believe as a nation, we have learned some things now about relying so much on foreign manufacturing of goods and products and supplies and equipment that we need during a crisis like we're experiencing now. So what I would say is through the joint leadership with our mayors and others, our goal is to look at opportunities where we can improve the manufacturing opportunities for us to kind of help ourselves as a nation. So all of that will, I think, dovetail with the stimulus package that's coming from the federal government and whatever the state will do. So we're having those conversations, across, I think, political lines and the political strata to make sure that not only we recover, but the state and the nation recovers quickly. So we're part of this ecosystem.
We have one more question there.
Yes. My name is Roxana de la Riva from La Prensa newspaper, a Spanish newspaper. And my question is for Dr. Pino in Spanish. Hemos recibido muchos emails de nuestros lectores donde nos dicen que el código 32822 es el que tiene más contagios. Es donde vive más comunidad hispana. Ellos nos han preguntado si ustedes tienen medidas más estrictas y creen que el Aeropuerto Internacional de Orlando es de donde vienen esos contagios. ¿Ustedes tienen un rastreo de estos contagios y la demográfica de por qué en el 32822 están sucediendo más contagios?
The question was, there are some emails that they have received from the community, especially those people who live in the zip code 32822. With a high concentration of Latino population and closer to the airport. And the question was if we believe that the higher concentration of cases in that area has to do with the closeness to the airport. And the answer is no. There has been it was an outbreak at the airport between TSA workers. And I should be answering in Spanish as well. But I'm going to go first with English. So there was an outbreak at the airport where a high number of cases were detected among TSA operators who have a communal living. Some of them share a space. So that probably was what fueled that outbreak. But we haven't seen any connections between what had happened at the airport and the surrounding communities. And it's difficult when you have a community-wide distribution sometimes to establish a connection because it's everywhere. So at some point, it becomes irrelevant to establish the connection. La pregunta, ustedes la escucharon en español, la respuesta es no hay conexión que nosotros pensemos entre el aeropuerto y los casos que hay en el zip code 32822. Donde hay una concentración alta de latinos. Pensamos que se debe a una distribución comunitaria en esa área y tal vez en el futuro, cuando analicemos las bases de datos, nos daremos cuenta que la densidad de la población tenga algo que ver también con la rapidez con que los virus se transmiten, o este virus particularmente. También habría que analizar, nosotros los latinos también tenemos una tradición de varias generaciones viviendo en la misma casa, un número alto de personas viviendo en la misma casa. Tal vez eso también haya contribuido a la rápida distribución del virus en esa área. Gracias.
Yeah, I have a couple questions. They're pretty quick here. Brandon Byrne from WFME, he says, with the federal government scaling back support of testing, this is at the convention site, how many tests per day do we anticipate starting next week?
Dr. Pino?
Yes. Well, the federal support is not withdrawing support. They are transferring the site to the state. Many times the federal government, not just in this type of condition pandemic, but in situations comes develop infrastructure, put in place, develop processes, and then transfer. And the state has said that they will support that effort and probably even increase the number of testing beyond the 250 that the federal government was doing. And I believe today they do almost over 300 tests, so a little bit more than anticipated.
This next
And
part.
just to follow up with that, the testing site at Orange County had 5,000 collection kits on site that was delivered. And so over time, we know that we will get additional supplies of collection kits here in the area. I will say that what the director for the Florida Department of Emergency Management said to me yesterday was that they do intend to increase the level of testing throughout Florida, and we should see additional supplies to support that within our area, and it will be thousands. I mean, some of the numbers that they provided were for distribution within the state was in the millions.
This next one comes from Melissa Thomas with Florida National News. This one's for Dr. Pino. Governor Ron DeSantis will be taking over the federal testing sites on Monday and allowing more people to come in as they've lowered the symptoms. Will the Orange County testing site do the same thing? And then do you know how those people will identify themselves, or what identification will be needed?
So our testing site right now, we are not using ID, and we are not planning to. With regard to changing the criteria, our criteria is limited because we are using the state lab, and the process at the state lab is very manual. So we are focusing on concentrating in first responder, healthcare workers, homeless, and people living in assisted living facilities. Those will be the target of our efforts, although we are planning to do a community-wide approach probably next week or the week after for increasing testing in our communities.
And this one, too, from Carlos Rosal from Telemundo. Dr. Pino, if you can answer this in Spanish. Why Orange County has not taken stricter measures to prevent the spread. Osceola just ordered the use of masks while in public places.
Bueno, yo no hago política. La política es para los políticos. And si el condado si Osceola decidió tomar ese approach, ellos tendrán una justificación. Yo entiendo los esfuerzos que estamos haciendo constantemente para aumentar o disminuir las posibilidades de contraer el virus. Las máscaras, aunque son muy efectivas, en algunos casos, también tienen sus situaciones. El CDC ahora las está recomendando para uso en espacios comunitarios de alta concentración de personas, pero si los alcaldes deciden aplicar una política similar en el condado, pues contarán con nuestro apoyo.
And I can follow up on that. Again, we're evaluating the practicality of that, because if we order people to do something, we have to ensure that they have the ability to meet the demands of that order. In other words, masks have to be available to them and all of that. And so matching up, there are many entities that have promised that they could deliver masks. We're in the pipeline to receive masks and other personal protective equipment from the state, but we haven't yet received the quantities that we really need. Orange County, by far, in terms of the population of this county, is significantly larger than any of the other counties combined. So when we put those types of orders in place, it has to be balanced with whether or not the people can actually comply with it. So that's of concern to me. So I'm really looking at the availability of masks in general. And to date, there have been some shortages, but that is beginning to narrow. And so I get an update several times a day on the availability of supplies. Well, did we receive what we put in the pipeline going to the state, et cetera? And do we have other alternative sources that could meet the gap that we have. And so we're still in that process. So we haven't said we won't do it, but timing is everything.
And Dr. Pino, would you just mind summarizing your answer in English for us? And then I have one final question.
Yes, so I will summarize my answer in English and also summarize the mayor's in Spanish. Lo que el alcalde dijo para los que hablan español es... I'm doing the mayor first.
Oh, I'm sorry.
Lo que el alcalde dijo fue que una medida como esta también requeriría de tener la habilidad de poder adquirir esas máscaras y que las personas las puedan usar y tener acceso, porque no tiene sentido imponer una medida de ese tipo que incluya también multas si no tenemos las máscaras disponibles para que las personas las adquieran. To summarize my prior answer is that, I do not engage in policy making. That would be policy, and it will be for our leaders to decide. And if they decide to do so, they will count with our support. But I do echo the mayor's concern that if a measure like this will have to be put in place, we have to secure their access to those masks so that people can wear it.
And Darlene Jones from WFTV for Dr. Pino. Why are there so many cases in which the health department doesn't know the race of the patient who has tested positive? How is it that they don't know race of more than 40% of the people?
So any data, when it gets collected, especially if you are collecting data in the frenzy that we are engaged, then there is a lot of room for error. And in many cases, it's not that we don't know, it's that we are not sure what the report was. Sometimes it's because of the writing, sometimes it was because of the check mark, how it was. And we prefer to say we are not sure about this one, it's undetermined, to make an error in the data. But progressively, that data will get clean, and those numbers will decrease.
Okay, thank you again for being here on this Good Friday during this Holy Week and during this season. I know that others will be celebrating or have celebrated Passover as well as Ramadan. And to our entire community, thank you for your patience. Thank you for always tuning in to these press events. We do appreciate it.